Welcome, everyone. I'm excited to have with me today Jessica Ann Kong, who is an RBT. She'll tell you what that is. She's also a master IEP coach. If you don't know what that is, I'll tell you what that is. What you all have to do is leave a comment, and I'll get to that information. But today, we're going to talk about a hot topic that Jessica is very familiar with. So, Jessica, welcome.
Hi, thanks for having me.
Will you tell us a little bit about what you do and why you do it?
Definitely. So I'm a registered behavior technician, also known as an RBT. I work with kiddos that receive ABA therapy, and I work hand in hand with the BCBAs in helping kids learn how to communicate with PECs, learning new skills, and just being able to access their environment and allow them to have a more inclusive experience.
So I want to have this clinical side of experience, and you're also a special needs mom, and you're also a master IEP coach. So talk about like knowing all different sides of the IEP table. You have that perspective.
Yes. So I actually was introduced to the special needs world way back in the 90s. My little brother is on the spectrum. Then I became a mom with a child on the spectrum. And then I became a master IEP coach and then was invited to become an RBT. So it definitely was an evolving process, but kind of once you jump into the special needs world, it's really hard not to just go in full force. I mean, it's one of the most welcoming and loving communities. I really like that a lot of special needs moms and other providers, they normally have siblings that are on that are special needs, or they've just always been a part of that environment that's just very loving and open.
Yeah, that we're getting a little feedback. Are you getting feedback on your side?
A little bit, yeah.
Okay, I think we're good now. That's how everybody knows that we're recording live, because that's not edited out. So with that, I want to make sure that everybody knows that they can hop over to your website. I'm actually going to put it up here below as we're talking. So I'll get that up, but it is jessicaankong.com. Is that correct? Yes. Okay. I'll make sure that I get that up below there as we're chatting. Because the topic that we're talking about today is that difference between clinical world and educational world, because there is a huge difference. So when we're talking in the context of IEPs, and we're talking in the area of behavior and data, and you're an RBT, and I know one of the things that you love to do is to help parents and BCBAs work at the IEP table together with their IEP team, which is a big task to take on. So let's kind of start back at the beginning and talk about what is the biggest difference between, getting therapy or support at school, so educational based, or clinic based.
Okay, so educational based, a lot of the programs are geared towards the child being able to access the special education classroom. It's normally coincides with the curriculum and what is considered an age appropriate skill level or skill set. So the school really focuses on that. If you're going to outside therapies and you're receiving, OT, speech, ABA therapy, those therapies are focused more on accessing the home and the community environment, and they're more one-on-one and individualized.
Right. So we talked about the purpose of an IEP, and we're like to prepare for further education, employment, independent living, and that's to do it, kind of in the realm of their same age peers of what's happening. Where the clinic-based, typically in my experience, this is where you find the biggest difference between best and appropriate. So school does what's appropriate for school-based, and clinic, they are working in a competitive outside service. So they want to give your child the best there. So it's two very different outcomes that we're looking for. Right or wrong, it's just how it is.
Yes.
So we have this different outlook, clinic and education-based. And there's a bunch of data being collected over here. There's a bunch of data being collected over there. And the IEP meeting comes, and the parent decides they want their BCBA to come to the table to help explain some things that are happening. Can you just share a little bit about what that dynamic is like at the IEP table, and what, I know we kind of talked about like what everybody's role is, and then where some of the conflict might be?
Definitely. So if you have a BCBA that's willing to come to the IEP table, which you do have to kind of get past, they get a little scared. I mean, they feel really confident within the clinical setting, and you're asking them to jump over into the school setting and join a team that's probably more established. They've never had a conversation with anyone else besides the parent. When they come to the IEP table, the BCBA is the data expert. Everyone at the table has their expertise. Obviously the teacher has the curriculum, the district has their own thing going on. And so there can be people get a little bit hesitated with trying to share their opinion because it's a new environment, and they don't want to step on anyone's toes. That's a big thing, but you have to realize and embrace that the BCBA is the data expert. They know how to look at the information that you've collected throughout the school year, the information that they've collected on outside therapies, and they can really connect some dots that are being completely missed if they weren't at the table.
And that's a BCBA's role is not to fix the IEP. A BCBA's role is not to say my data is better than your data. That's not what we're looking at. We're looking at bringing an extra set of eyes that knows the child, that can look at data. As a parent, it's going to be super important for you to establish that desired outcome of this is an extra set of eyes and ears. As a teacher, if you're at the table, regardless of how your district feels about that person being there, because sometimes there's some pushback, lean in and listen, because this can be a gold mine to make your job easier in there. But there definitely can be some hesitation from the BCBA to share, but there can be the other side of it too, right?
Yes.
So sometimes BCBAs tend to go in and be a little bit bulldogish about.
Oh, yeah. Yes, they get very excited about their, visual aids and stuff that they have, and they get excited about sharing.
Yes, and they want to show all the things and how awesome it is.
Yes, yes.
And we have to make that connection over what are they doing in the clinic that pertains to the education. So that's why we started with what's the difference between the two. So we really need to look at what are they doing on the outside that could be utilized on the inside of the school system with that. So what do you recommend? Give some specific examples, and I'm kind of putting you on the spot here because we didn't talk about this piece. What are some specific examples of something that you might be working on in the clinic that you'd be taking data on that truly would apply to school?
So we actually in ABA therapy work with a lot of different things. We work with receptive ID a lot of times, which has to do with like colors or even familiar people. So a child being able to understand pronouns, for example, like he or she, a lot of kiddos on the spectrum, they really struggle with understand this is a picture of a female and that would make it her a she, or this is a picture of a male. And so we would refer to him as a he. And, we would do that, or colors, lifting up colors and saying, what color is this? If a child is unable to recognize colors, there could be other things that we're missing, maybe they're colorblind, but we don't know that unless we're taking the data and seeing which colors it is that they're missing on a regular basis and which colors they do seem to recognize without needing additional prompts. A lot of other things have to deal with like their transitions. If the kiddo is able to transition from classroom to classroom, if they're receiving therapies in different rooms besides their general education classroom or their special education classroom, are there special things that need to be put in place for the child to be able to transition and to be able to access those things to have their own experience within their school system?
Absolutely. So we talked about a really key word that when it comes to mastering a skill, you also have to be able to generalize it. So can you talk about what generalization looks like? Like, what does that word mean? For some people who are listening to this, they're like, I think I know what generalization is, or they're assuming, but kind of talk from that BCBA or RBT standpoint of what does generalization really mean?
So generalization means that the child understands a concept in all environments. So if they're learning a concept within our clinic and they go home and they are not getting the same skills mastered at home, then there has not been generalization. It means that there's something within our environment that is helping that child to complete a task. So our biggest goal then is to try to find out how to help that child reach a point where they can access generalization and be able to do the same skills in every environment, at home, at school, and in the clinic.
So that's something that's super important, that RBT or BCBA, or if you're bringing an OT or a PT or speech that works clinically, that's a really great conversation for your expert on the outside to bring to the team, saying, you know, we're working on generalization, because although it's not talked a lot about in the IEP process, that really is, when we look at the purpose of an IEP, to prepare a child for further education, employment, independent living, that doesn't say within the school environment. That's just, they're talking about life. And a lot of times we don't talk about this until we get to that transition time, 14 years old, 16 years old. That, to me, that's too late to be working on generalization.
Oh, it definitely is. A lot of times parents will hear too, well, the child doesn't have that problem here at school. Then there's something happening at school that's helping with that behavior or with that skill. And open communication is the only way that's going to help with generalization, to help that child be able to do that in the community and in home as well.
Ooh, you just hit on something that some people are going to have this aha moment and think, yeah, what if the school's prompting too much? What if the aid's too close all the time? What if the work is too easy? What if, right? So a lot of times when I was a teacher, I use the word sabotage, because that's just it. Like, we would sabotage a child's day, not in a cruel way, in a way of like, okay, this is getting switched up today, or this tool's not available today, and we need to adapt to something changing, because we can't have it perfect all the time.
Yep, exactly. Because when you go out into the world, it's not always going to be the same way every time.
Absolutely. So I hope somebody wrote down that nugget right there, where they're talking about, you know, they're thinking about, okay, how come my child is being successful at school and not at home? You have to look at all of those things happening at school.
Definitely.
Okay, so you have some freebies on your website, so I want to make sure that everybody hops over there. That's how you get connected with Jessica. Jessica will also be watching the comments here on this video. Wherever you're watching this at, we can always tag Jessica to help get you some answers. So if you have questions about any of this, just let us know. We'll make sure to get you some answers. But the takeaway really is, make sure that your clinical team and your educational team are communicating.
Yes.
We got to make sure we have some goals that are generalizing, that we know what the roles are at the IEP table, that we know that the goals are going to be different in both environments, but we can get them connected.
Definitely.
So, all right. Well, Jessica, thank you for being here today.
Oh, thanks for having me.
All right. We'll chat again soon.